Republicans from the House and Senate Appropriations Committee have made an opening offer to Democrats as the two parties launch negotiations toward a deal to fund the government before the mid-March shutdown deadline. Congress's top appropriators gathered privately Thursday evening in the Capitol for an hour-long Four Corners meeting. But it's unclear exactly how successful bipartisan talks will be when, according to the New York Times, House Republicans are discussing several strategies to fund Donald Trump's agenda, including making cuts to Medicaid. Now, those same House Republicans will be down at Trump's Doral Resort this coming week to discuss the contours of the Trump agenda, which is expected to include legislation on the border, energy, and tax policy. Joining us now to discuss, Democratic Congresswoman Sarah McBride of Delaware. Welcome, Congresswoman.
Welcome, Congresswoman. Can we just talk about, in terms of the funding, obviously the president and Republicans in Congress have been very clear that they want to make cuts and to pay for some of the things in their agenda, and they want to slash some of the debt, they say. I don't know how what I'm about to tell you is going to slash the debt, but maybe you could tell me. This is from the New York Times. House GOP floats Medicaid cuts and more to finance Trump's huge agenda. Top Republicans are passing around an extensive menu of ideas to cover the cost of a massive tax cut and immigration crackdown bill. They could establish new work requirements for Medicaid recipients, bringing in $100 billion in savings. We've heard from Democrats that they're going to protect Social Security and Medicare. Are Democrats going to protect Medicaid?
Absolutely. What we are seeing right now by Donald Trump and Republicans in Congress over the last week, and what we will likely see in the weeks to come, is the great betrayal. They campaigned over the last year on lowering costs facing workers and families. And what we're going to see, and what we are already seeing, is an attempt to line the pockets of Donald Trump's billionaire friends while cutting programs and benefits for working people in this country. We will be defending Social Security and Medicare, and yes, Medicaid. Nearly 1 in 4 Delawareans rely on Medicaid. Those are Delawareans in families living in poverty and Delawareans with disabilities. And instead of cutting this critical program, we should be expanding it and improving it like we've done here in Delaware. When I was in the state legislature just last year, we passed unanimously with bipartisan support my legislation infusing our state's Medicaid program with the largest ongoing source of new resources since the Affordable Care Act to protect it and expand it for the people who rely on it. So we should be moving in that direction, not cutting this program that so many of our constituents rely on.
I think a couple of things that are important to level up in this conversation so that we don't confuse people, because people get Medicare, Medicaid confused. They think it's all the same. But Medicaid is a state program, but the important thing about it is it's health care for the poor. And that's basically what it's monies that are used, as you noted, Congresswoman, for those with disabilities, the poorest in our communities. There are poverty level requirements for this. So the fact that we have Republicans now advocating for the elimination of health care for the poor, that's what we need to be talking about, in my view, and not just framing it as a Medicaid discussion, which is bureaucratic and process-oriented, but putting the real fine points on it, as you noted, how it's impacting and will impact Delawareans, and how, more importantly, what this means for those folks when those programs are cut. I can tell you, just to go off on a little bit, before my mother passed, her Medicaid was cut off 3 times. You know why? Because she was $300 above a $6,000 limit. So that's what we're talking about here. The limits that poor people have to face, that you can't have so much money in your bank account. And Republicans are now saying you no longer qualify. We want to cut these programs. For me, that, Congresswoman, is the passion in this discussion, not the bureaucracy and the bureaucratic bull that the Republicans want to focus on.
Yeah, you're absolutely right. Medicaid is different than Medicare. It's administered by the state through a joint contribution between the state and the federal government. And so if you hear the Republicans talking about cutting federal dollars for Medicaid, what we have to be clear about are the real world impacts of those cuts on people we represent. Like I said, 1 in 4 Delawareans rely on this program. That's new moms who are living in poverty, who are already facing a maternal health crisis in this country. Today is National Maternal Health Awareness Day. We have just expanded Medicaid to cover 1 year postpartum for new moms, a critical point in both the lives of new moms and their children. I can't believe that the pro-life party wants to cut maternal health care. We know for Delawareans with disabilities who rely on Medicaid for long-term care, for home health, to be able to get through the day so their parents can go back to work. Even if they're adult children, their parents can go back to work so they can get care throughout the day. This would mean cutting these programs, this coverage, and also making it work less well for providers, which would mean fewer and fewer providers, especially in areas like rural communities and urban communities where so many patients rely on Medicaid for coverage.
It is. I mean, this is the real world impact of these policies. You've recently been named the Democratic Whip of Policy for the House Democratic Caucus, Congresswoman. It's noted that you're going to prioritize lowering costs facing families in the 119th Congress. I know Democrats want to talk about lowering the costs and working with Republicans where they can, but Republicans are talking about all these other things that do not seem aligned with the Democratic agenda. You have the President of the United States issuing executive order after executive order dismantling the long-held policy as it relates to our civil rights, okay, from the 1965 order that created affirmative action and equal opportunity. You have these orders on specifically what he has said about prescription drugs. Now he's rescinded that Biden order. Orders on about trans people. Just what is the Democrats' posture here? And I'm definitely interested in. I'm sure you've had a lot of inquiries this week, given just all the crazy from these executive orders specifically and the chaos they have that has ensued.
As you noted, we will certainly find common ground where we can. That is the responsibility of elected officials, but we will stand our ground when we must. And the last couple of days have been a glimpse into what we will likely see from this administration over the next 4 years. Look, Donald Trump kept pretending like he had never heard of Project 2025, but the vast majority of actions that we've seen in just the last couple of days come straight out of the Republican playbook. They lied throughout their campaign. They said they were going to focus on lowering costs facing families. They're not. They said that they didn't know what Project 2025 is. Well, they're staffing their administration with its authors and already implementing that agenda. The president said on Monday in the rotunda that we were going to be entering a golden age in America. But the reality is that they're taking us back to the Gilded Age. They're taking us back to the 1880s, the 1890s on economic policy, lining the pockets of the robber barons. But they're also taking us back to the 1880s and 1890s on issues of basic rights and freedom in this country. And I believe that as these actions come forward, people will react and respond in a way that will hold the administration accountable alongside Democrats in Congress. And I'm going to be working my heart out over the next 2 years to make sure that Democrats get the majority so that we have a bulwark in the House that is able to protect the financial security of Americans and the rights of our neighbors.
Congresswoman, I know we're getting ready to let you go, but I just want to say this. I need to chill on this kumbaya bipartisan crap, because at the end of the day, here's your headline. Republicans shoot down Democratic request to ditch party line immigration push and write a bipartisan bill instead. Senate Republicans are making it clear they will pursue a border package without Democratic input. They don't want to work with you. They're not going to work with you. They have the House, the Senate, and the White House. Let them choke on that.
You know,
do not
Congresswoman,
help them out because they don't want your help. They're telling you they don't want your help. So y'all need to just come to the table real and understand that the person sitting on the other side don't want you at the table. Get up, take your coffee, and go into another room.
Michael still said when they go low, y'all better go toe to toe.
Let me just say this. I think the American people want to see elected officials be serious and work together.
No, they don't.
But you're right. You're right. They're not doing that. They are not doing that. They've made it clear, from immigration to economic policy and taxes to basic human rights, they have made clear that they are more interested in driving forward a extreme partisan agenda rather than pursuing collaborative, common sense solutions. I totally agree.
All right.
Congresswoman Sarah McBride of Delaware. This is why she's a policy person, because she's I got an answer for that.
I know.
Thank you very much,
Thank you
Congresswoman.
for your patience,
We look forward to seeing you again soon.